Good afternoon, everybody. Thank you for joining me today. Today I want to talk to you about a subject that's top of mind for all Canadians, and that is COVID-19 vaccines. We need these vaccines to protect ourselves, our families, our healthcare system, our community and our economy. Nous avons besoin de vaccins pour nous protéger nos familles, notre système de santé, notre communauté, and notre économie aussi. Normally, provinces in normal times run health care, and it is in Canada's Constitution after all, but these are not normal times. And because of COVID-19, the federal government decided some months ago that it would take over the responsibility of procuring vaccines for all Canadians. Our responsibility here in Manitoba and across the country, across all provinces and territories, is to distribute these vaccines, and you've had a report earlier today from our vaccine team on their level of readiness, which I think you'd agree is most impressive. There are two problems with this current system. First of all, the federal government is not getting vaccines to Canadians. There are a number of reasons for that, and as of this morning, we are 54th among the nations of the world, and Canadians are made to wait for vaccines. And you know, because you've had the report from our vaccine team, that we could vaccinate every Manitoban in the next 8 weeks and save lives in the process, but we cannot, nor can any province, distribute and administer vaccines that we do not have. Now, let's be absolutely clear on this. I raise this point while saying, as I've said repeatedly, all of us are supportive of the federal government's efforts. All of us are cheering for the federal government, in fact. But right now, it is an honest observation to say that we are forced to wait. Secondly, even when vaccines begin to flow, as we all hope they will flow very soon, the supply chain could be interrupted again, and again, and again. And each time it is interrupted, Canadians will wait again. And part of the reason for that is that none of the present vaccine providers are Canadian. They're all foreign operated or located firms. And so this could be an ongoing problem unless we begin to address it now. I was disturbed by some comments that were reported by the CBC on an interview with Canada's co-chair of the vaccine force late last week. A number of comments that I felt were of concern, but one specifically, which I quote now, "We sometimes have to wait and be patient. Making a fuss about it does not solve the problem." Well, you know, ignoring the problem doesn't solve the problem either. And so I'm less about making a fuss than I am about finding solutions. And when it comes to protecting Manitobans and when it comes to protecting Canadians, we should not be patient. Real lives are at risk here. And so that is why last week Manitoba announced that we are investing in a Made in Canada production partnership that we hope can address both of these issues and provide the insurance and peace of mind that we all need for all Canadians, not just for Manitobans. There are issues of supply, reliability that have to be addressed. Manitoba's agreement with Providence Therapeutics, based in Calgary, to support the development of a made-in-Canada vaccine addresses three important issues. One, we have a lowest price guarantee built into our term sheet, and I'll release a summary of our term sheet today. Our contract is in final stages of negotiation, I'm told, and when it is finalized, it will also be made public. We believe this transparency is important. We believe that lowest price guarantee will put our price lower than the United States or the EU is paying. We do not know what the federal government's price is because they have not released their agreements, but we understand that we will be getting a better price. That's what we've been led to believe. Manitobans are smart shoppers. They want their government to be careful with their transactions and to shop smartly with their money, and that's exactly what we're doing. The second thing here is we will be getting their first release of vaccines when they are approved and move into production. And thirdly, because of their Canadian location, we believe that delivery of these vaccines is at much less risk than the delays and supply circumstances we've had to face with other providers that the federal government has arranged thus far. Other provincial governments have already expressed strong interest in this initiative. We last night had a deputy minister's call involving all provinces, territories, and the federal government. Tomorrow we will be having a national call with all premiers and the Prime Minister on this issue as well. Enhancing Canadian vaccine production, let's be clear, at this point in this pandemic, may be too late to address the vaccine supply challenges that we have been facing this year. But this is an important thing to understand going forward. Next year, although the science in terms of timing or the need is yet to be verified, we do believe that there will be a need for booster shots. When those booster shots are needed, they're going to be needed. And if we have similar disruptions next year, then we are back to a lot of the negative effects this pandemic has created for Canadians already. We don't need a repeat of 2020 and early 21 in 22, 23. So there is also the reality of variants and related viruses that may cause additional risk and pain to Canadians and to our economy and our communities have to be addressed. So our hope is that this initiative and others like it will result in Canadian vaccine production being more readily available in the coming year, even though it may not be available this year. This isn't a short-term battle. This is not a sprint. It's proving to be a marathon. And so we need to take actions that are forward-thinking, and we believe this is a forward-thinking initiative. On an ongoing basis, relying on other countries to bail us out isn't a preferred Manitoba strategy. Our Manitoba history, our Manitoba character has always been that we demonstrate in our actions and in our deeds that we are people who like to help others out. As Manitobans have always done. We've led the country in charitable supporting and volunteerism since those statistics began to be kept. And we're proud of that record. That's what Manitobans have done. That's what Manitobans want to continue to do. Notre stratégie de Manitoba signifie que nous pouvons aider les autres. C'est ce que les Manitobans ont toujours fait. C'est ce que les Manitobans continueront de faire. I also wanted to share with you that Elections Canada officials have been in touch with our officials here last week. And I want to be very, very clear to them and to the people of Manitoba that should the federal government decide that it wants to call an election this spring, Manitoba schools will most certainly not be made available for polling stations. Keeping our students, our schools safe, it remains a top priority for our government, for our Manitoba families. As we deal with the ongoing challenges of this pandemic, we must continue to be diligent and we must continue to be careful. So I don't think I should say out of an abundance of caution, out of reasonable caution, we know that our students learn best in a learning environment that is in a classroom. Our public health officials, our teachers, our educators, our students, our families have done an incredible job of keeping our schools safe thus far. We want to keep it that way, so I wanted to be very, very clear, and we will communicate such to the Manitoba, through our officials here in Manitoba, to federal government officials. We are not going to be having polling stations located in our schools. I welcome your questions.
Thank you, Mr. Premier. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from the Winnipeg Sun, Scott.
Good afternoon, Premier. I guess, what is the solution then? I mean, you say that we need to not be patient. Yes, there's a lot of countries in the same boat right now. This Providence vaccine won't be ready this year. So, I mean, what is the solution then? I mean, what else do we do other than be patient right now?
Well, the solution is to drive to find solutions that may not address short-term things necessarily. The solution lies in thinking forward. Forward thinking is what we're doing by entering into this arrangement. We're trying to make sure that we're not losing sight of the benefits of having Canadian production available for vaccines, whether it's boosters, variant treatments potentially for the next pandemic potentially. We benefit by having Canadians, Canadian companies, Canadians involved in the manufacture of these vaccines, and we benefit because the chances of supply chain disruptions are lessened as a direct result of that. So we're thinking ahead, and when I say I react when the vaccine co-chair of Canada's task force says that we should all be patient. Well, we are. We're ranked in the mid-50s now in terms of getting vaccines, but there's a reason for that. And part of the reason, at least, is that we don't have our own ability to produce our own vaccines here in Canada. We should have that ability.
Thanks for that. And yeah, I guess that is the case, and we should have it, but we don't. So, and you quote the 54th rank and all that. I guess, what do you want the federal government to do about it right now to get more vaccines into this province and other provinces right now?
Well, you're asking me a short-term question. The short-term answer would be get the vaccines here. But the reality is, of course, it isn't that easy because of the situation that we put ourselves in. Relying on foreign providers has its risks, and that's being shown as a consequence of the ranking. It's being shown as a consequence of the supply chain disruptions. It's being demonstrated by the protectionism of some countries and some providers potentially. It's being demonstrated clearly by the United States saying that Americans first. They're not interested in partnering with us at the federal level in any case. So the reality is that we need to keep looking forward to a better system, and the better system involves being able to support ourselves. Can't help the needy of the world, Scott, if you're one yourself.
From CBC Radio Canada, Matthew.
Hi, Premier. It's possible to know what is the unit price for the Providence vaccine?
Encore, s'il vous plaît, Matthew.
Hi, Premier. Premier, it's possible to know what is the unit price for Providence vaccine?
$18 Canadian.
Thank you. I don't have follow-up questions.
I can elaborate a little bit if you like, because although we don't know the Canadian price because it is the contracts are not the Canadian contracts are not made public, we do have the prices from other jurisdictions somewhere here, and I'll go ahead to the next question and see if I can find those prices if I have them in my notes, and I'll share them with you later, Matthew, okay?
Thank you.
You bet.
From CBC Manitoba, Bart.
Afternoon, Mr. Premier. How did you first become acquainted with Ken Hughes, the board chair of Providence Therapeutics?
I actually don't know Ken. I became acquainted through briefings with two Canadian firms that are capable of dealing with this messenger RNA, which you explained so much more capably than I could in a recent broadcast. One of those companies, Medicago, is a Quebec-based company, and the other one, Providence, is a Calgary-based company. We felt it was wise to explore the possibility because they would need orders to see if we couldn't advance their research and their potential ability to move to testing and then trials and then to approval, and you know that process very well, by seeing if we could place an order with them. We had been trying for months to place orders with other companies. Without exception, they told us that because the federal government was ordering from them, we were blocked in our ability to get our orders placed with Pfizer BioNTech, AstraZeneca, Moderna, Novavax, and others. We contacted these companies numerous times and got rejection slips from them all. We felt that These companies also, as you know, are based in various locations around the world. We felt it was wise to pursue a connection with a company that could actually move to production here in Canada, because we saw the interruptions that were happening with the other suppliers, and also the opportunity to get in a position where in coming months and potentially as early as late this year, early next year, we'd be able to have vaccines for Manitobans. That's the actions we've taken, and that's the priority that we put on protecting our citizens here in Manitoba.
Thank you for that. Topic change here. Earlier today, Mayor Brian Bowman was asked about the issues the city has been having with homelessness and shelters and the very cold weather we have. And he claims, or he says, that he went to the province, eventually got a meeting with the families minister, and was told the province wasn't going to help. He used the line saying, your government is, quote, missing in action. How would you respond to Mayor Bowman's assertions that the province has not been helping the city out with homelessness in the cold shelters over these past 10 days?
I won't take the bait, Bart. How about if I just say, among many other initiatives, just last week, Minister Squires announced close to $500,000 investment in a COVID isolation unit at the Main Street project, and leave it at that. Your research will demonstrate dozens of other examples where we're supporting those in need and vulnerable people within the city of Winnipeg.
From the Canadian Press, Steve.
Premier, I guess I got to burn up one of my two allotted questions on a clarification. When you said $18 Canadian, is that the unit price that you've agreed to with Providence?
Yep. Steve, you'll see a copy of the summary of the term sheet. I can't put out the contract because it hasn't been agreed to chapter and verse. All the T's aren't crossed and I's aren't dotted. But when it is, I've undertaken to make sure there's going to be no blacked out portions. You'll see the actual contract. The $18 represents total order cost of $36 million. We pay a down payment after the contract is signed and not before of 20%. That assists the company in a number of ways to enable it to move forward. Then we pay 40% on approval by Health Canada and 40% of the total cost upon delivery of the doses. And I will, Steve, go back for a second and just say on price, the U.S.'s contracts for vaccines, of course it varies by company, but costs per dose are in the range of $24 to $35 in the United States. European Union, we have information between $18 and $22. Canada, you know, rumor from unidentified anonymous official in Ottawa, $38. Manitoba, $18. Now look, these are all subject to verification, and the point isn't what the price is when there's no vaccines here. The point is to create a situation where there can be vaccines here that can be injected into people's arms. Right now, with the shortage of vaccines, I think Canadians care less about the price than they do about the availability. Ultimately, when the federal government achieves its goal of flooding us with vaccines, which we hope happens sooner rather than later, then the issue will become, well, how many can you get for the dollar? And that's where we're pretty pleased, I think, at this stage that we've got not only a good initial price negotiated, but also a best price guarantee built into our agreement, which says if, for example, 5 other provinces get on board with Providence and they can boost their orders, they may be able to offer a better price. If they can do that, every province benefits, and that's the position I think Manitobans want to be in. If we can help our fellow Canadian provinces and Canadian taxpayers to get more vaccines for a better deal, that's part of what a Canadian family should be doing.
And my second question is a two-parter. Alberta Premier Jason Kenney said last week that his understanding is that Providence can only go ahead with production in Canada with about 50 million doses ordered. If that is true, does that give you cause for concern? And why not put your eggs in the Novavax basket that the federal government has invested in, domestic production of the Novavax vaccine?
Well, we have our eggs in the Novavax basket, to use that analogy anyway, because the federal government's made that investment, but where they haven't is with Providence. So I think more baskets, more eggs. And, I think it's also fair to say, because I understand that the principal, Mr. Sorensen of Providence, did testify in a House of Commons committee yesterday and was asked about other provinces, and did say that he's in discussion with both province of Alberta and the province of Ontario. And so our initiative may help, I hope, to spur, just as it has spurred other dialogue about this important issue among the provinces as recently as last night, and again with the PM and premiers tomorrow, that it will spur action and investment so that we can assure ourselves of a more available domestic supply.
From CTV Winnipeg, Jeff.
Hi, Mr. Premier. I'd just like your opinion on the federal legislation that would allow municipalities to ban handguns.
Well, look, Jeff, it's just not going to work. So my opinion would be that. It's not going to work. Public safety issues aren't just germane to one or another municipality. They're issues of national importance, and I think quite frankly, we benefit by having that discussion at a national level, not at a municipal level.
So would you support a national handgun ban?
No, I didn't say that. I said I'd support a national program that would provide greater security and respect the rights of honest farmers and hunters and people like that to use their firearms in an appropriate and safe manner, as the vast majority do now.
From City News, Jonas.
Good afternoon, sir. I just want to touch base on this deal with the therapeutics company in Calgary. The money that is pledged, is it out the door, or is it not until a contract is signed? Is there any actual outlay yet from the province to the company, or is it not until the contract is in fact signed?
Yeah, when the contract's signed, there'll be an initial down payment or a deposit of 20% of the total cost of the contract, which amounts to $7.2 million Canadian.
Oh, thank you for that, sir. I just wanted to confirm that that was the standard or the procedure moving forward. And I guess as a follow-up, what can you tell us about this company's ability to bring drugs to market? As far as I know, they have not yet brought a vaccine to market. Is this correct?
They have an extensive record of researching through this messenger technology, messenger RNA science, more than arguably any other Canadian firm, the ability to develop drugs. They've established, they were the first Canadian company to incorporate this technology in 2015. They've been active in developing cancer drugs. Mr. Sorensen himself was inspired to pursue this as a consequence of cancer within his family. I won't get into the details, but you can research those. We've had very good reports of the operation of this firm, of their respectability and capability. And as was noted earlier, there is only one other Canadian firm. That's the one the federal government has initially put some money into in Quebec. So this is not without risk, and I would not underplay the reality that we are putting capital at risk here. But there's a risk in not doing this too, and we're seeing that, and we're paying the price for that in terms of delays in getting vaccines to Canadians. So I think this is time to act. I think we're acting very responsibly. We've researched the position we're taking, and I'm careful with taxpayers' money, so I think this is one of those ones where I hope it'll be demonstrated that there's some wisdom in this, but that'll depend on Health Canada's approval, on the trial results, and it should depend on the onerous process that is involved in getting a drug approved. But this is a company which we believe can do this job, and so we are willing to put some money down on behalf of Manitobans, and we hope other Canadian provinces would consider doing the same. Potentially the federal government would consider doing the same, so that whether it's later in this pandemic or next year for boosters or, who knows what's coming down the road, that we're never again going to be made dependent by an over-reliance on foreign suppliers.
From CHVN, Taylor.
Hi, good afternoon. What are your expectations for uptake of the COVID vaccine in southern Manitoba?
Yeah, it's a really good question, Taylor, because I just actually had a really good discussion with Governor Burgum of North Dakota today on that topic and many others. And we both recognize that it's very important to encourage our citizens to take advantage of the vaccines that are going to be made available to them in order to speed the herd immunity that we all want to see happen. And so part of that, I think, is to help people understand the benefits and to help them understand that the risks are pretty minimal. At the same time, there's honest reasons why people might be concerned about taking a vaccine. And so we have to address those honest concerns and encourage people, because the benefits are very real for all of us to not have COVID persist and continue in our province. And especially, I think, when you think of our economies so intertwined with North Dakota and other United States, it's a real benefit to have them be safe and us be safe so that we can open up the borders. So that, Taylor, you can go. I understand that you might like to go and shop once in a while in the United States, and they might like to come here and watch a Jets game. And we'll be better able to do that if we know we're keeping each other safe in the process.
Thanks. And obviously the province has been thinking about buying the vaccine on its own for a while, but what was that tipping point to actually say, yes, we're going to do this?
Well, yes, you're right. We have been looking at that. We've been getting rejected more than I did as a young man, getting rejected all the time by drug companies who said that they would only deal with the federal government and not deal with provinces, and then combining that with the reality that we were at one point, I think, 16th on weights, in terms of the ranking of where we were on vaccines administered per 100 people that you see. Oxford University puts out a ranking, the Globe and Mail, I think, puts out one as well. And seeing us go from that ranking to 22nd to 29th to 35th to 44th to 57th yesterday is not making me comfortable, and I don't think it's making Canadians comfortable. And I think we need to take action now, not just for today, but for the future as well, to make sure that this is the type of thing that isn't allowed to ever happen again.
From the Winnipeg Free Press, Carol.
Good afternoon, Premier. You said that the rapid testing kits that the federal government provided Manitoba aren't very good. You compared them to a Pinto versus the Lincoln that the province purchased on its own and is testing teachers with. But isn't a Pinto better than nothing? Isn't it better than walking when we're reopening and we're still waiting for vaccines and variants are threatening us with a third wave possibly?
Yeah, no, that's a great, I think that's a very valid observation, Carol. As a guy who hitchhiked for 3 years to get to university, I could tell you I would have liked that Pinto at that point in time a lot. So yeah, if you were in a situation where it was that or nothing, if you're in a situation where you didn't have another alternative, for sure, that Pinto would be great. But we aren't in that position. We decided that we wanted to invest, and we've invested close to $50 million in equipment that we think will provide more reliability and better result for us. And at the same time, we've also improved our testing capabilities to such a point now that our wait times are really down low, as you know. And so because of that, the waits associated with PanBio Abbott equipment, which I've never described as bad stuff, I hope, but rather just a little more range there, right? Unreliable versus what we invested in, which is more reliable. Combine those factors together, and you've got a situation where we're, I think, getting better test results, better turnaround, and more accurate test results for people that need it so that we can get them back to work safely sooner. I think it's a good solution. The PanBio equipment, that was the information from the federal government, was that was pretty much what we had in the fall. May have some congregate setting uses that we may be able to, we have used some of it as you know, but we've invested in the Songbird hybrid equipment, which is more reliable for our purposes and with a faster turnaround time. So that's where we put our money, and I think Manitobans are the beneficiaries of that investment.
So I know you're very frugal and are careful with spending. So what's happening with all the unused rapid tests that Manitoba has but isn't using? Are they being shipped back to where they came from, to Ottawa, or can we give them to another jurisdiction or to a country that's developing? I don't know. What's happening with them?
Yeah, that's a really good question too, Carol. As you noted, I think it was the CBC that first ran this story. And you'll note that virtually every province is under 25% use, and most were under 5% use of these. So it's not like we can help another jurisdiction in Canada by giving them this equipment, because they already have a surplus of it for their purposes. And so I just make the point, it's a good point, that I think that, you know, if this equipment was the only answer, you wouldn't find that every province wasn't using it very much. You know, we have provincial health administrations right across the country that determined that this equipment wasn't really of great benefit to them versus other equipment, other approaches they were taking. It's not just Manitoba, of course, it's virtually everybody across the country. A couple of jurisdictions have used, I think BC's used the most, if I remember correctly. Carol, you'd have the numbers there. Yeah, the question of surplus equipment being useful in other countries it's an interesting one. The tricky thing is those other countries are now getting vaccinated. And so as they get vaccinated, they may have less need for the PanBio equipment than those countries like us that aren't. But we're using better equipment that's more reliable. And that's how we're able to get better test results faster to Manitobans.
From Global News, Joe.
Good afternoon, Mr. Premier. I am just wondering, well, it sounds like you know what the feds have been saying in the media, but have the feds said anything to you directly about your decision to make the deal with Providence?
Well, no, we'll talk tomorrow. You know, the feds, let's be clear, the feds have done a similar thing. I mean, you know, I think there's no doubt that our over-reliance is hurting us right now, but the federal government's invested in a company called Medicago. That's the only other Canadian company besides Providence that's, we're told at this point anyway, got that messenger RNA tech stuff down. So the feds are investing in them. I think Premier Legault was in the final stages of adding some money into Medicago as well. It's in his province. I understand that Alberta and Ontario governments are also in conversation with Providence about potentially ordering doses from them. So this is moving, and I hope it continues to move forward because, again, I think the greater reliability and the potential savings that'll allow us to invest in other things, like the massive wait times we have because of the backlog of surgeries because of COVID. You know, every dollar we can save on the vaccines, we can put towards healthcare in some other category, and I think that's going to be a good reallocation.
And you mentioned your conversation with Governor Burgum south of the border. Are you guys having regular conversations, and what regularly discussed, if so?
Well, we discuss a wide range of issues. There's much that North Dakota and Manitoba share in terms of our, you know, our mutual benefits economically and our social history. Today we talked about challenges facing Indigenous people on their side and on our side. And in particular, I think the need for more vaccines for vulnerable populations. Seniors especially and Indigenous people are vulnerable, and we need to take some strong steps forward to get vaccines as soon as possible to those most vulnerable people. So Governor Burgum and I talked about that among a number of other issues. I like Governor Burgum a lot. I think he's an honest, hardworking guy, and I have enjoyed our conversations very much.
Our final reporter this afternoon, Mr. Premier, from the Brandon Sun, Colin.
Good afternoon, Mr. Premier. You mentioned that if more provinces buy in to this Providence plan, the price could be per unit could be reduced. But could also, if more provinces buy in, could the time be sped up for when it's approved by combining efforts and adding resources?
Yeah, that's a potential benefit, Colin, for sure. I think that that might speed up because every company has limited resources, and this is not a giant company. This is a small Canadian company, so that'd be helpful. The second point, too, that I should mention is that this is, I think, an unselfish deal on our part we're looking to make. We're not looking to try to get ahead of every other province. We're looking to try to give an opportunity for the company to get ahead of other foreign companies so that it can produce vaccines that would be available in Canada. We have, you'll see in the term sheet, the first 200,000 doses produced by Providence this year will be supplied to Manitoba. All additional supply, if they can get a higher production, will be allocated on a pro rata basis with other provincial orders. So that's in our agreement. So what that means is, of course, that we're not putting claim to everything, 100% of their production. We're simply saying we know that if they can get to production, that we would need the first 200,000, and after that we'd share with other provinces. And this is what I mean when I say this is Manitoba's tradition. We're a pretty unselfish people here, and we'd like to see other. We're part of the Canadian family. We'd like to see other Canadians get good vaccines available to them too, and at a fair price. And we also have a lowest price guarantee. So if we can get a big province like Ontario on board with a big order, and they can get that price down even further, we get that price too. So that's a good deal for all of us. It's a win-win for Canadians who want that vaccine. It's a win-win for provinces that want to get better value for money. And I think it's a better confidence booster for all Canadians knowing that they're going to be able to count on vaccines being here when they need them.
My second question is about your search for the right vaccine to buy into. I noticed that there's a firm out of the University of Saskatchewan that is developing its own vaccine. I believe it's Vito Intervac. Is that something your government looked into when searching for a vaccine to purchase and manufacture in Canada?
Yeah, and I don't want to get too much into the science, mostly because I'm not a scientist, so I'm not going to pretend to be. But I can tell you that the Saskatchewan research is that. It's research, it's scientific research. But what we're looking for is not just research, but applied technology to manufacture vaccines. And so the relationship that Providence has with a Winnipeg-based manufacturing firm, well known, is important because we'll be able to get the production, move to production with the idea. It's not just enough to have the research, it's important to have the production as well. And I would mention AstraZeneca is based in the UK with German and Belgian subsidiaries. Janssen Chemical is in Titusville, New Jersey. Moderna is in Cambridge, Massachusetts. Novavax is in Gaithersburg, Maryland. Pfizer in New York with offices in Germany and Belgium. And Providence is in Calgary with manufacturing relationship with the Winnipeg firm, right here in Canada. I want to remind everybody, stick to the fundamentals. We got to play defense now. It's going to warm up a little bit and everybody can get back outside. That's going to be a good thing because we want you to stay out of those close contact settings, avoid crowded places, get that dog on a leash and let her lead you on a walk. Closed spaces are dangerous. Just stay away from them. Wash your hands. Stay home when you or any member of your family's sick. Wear a mask. Limit your close contact. Stay positive. And a belated happy Valentine's Day to my wife and all of our Valentine's lovers out there in Manitoba. All the best. Talk to you soon.